I'd like to go ahead and introduce our next panel. And one of our panelists on the next panel is joining us by phone. And so I'm hoping that she is able to hear us introduce her and at the appropriate time can give her remarks. And I just want to remind you again that if you want to know more about our panelists, including the one who is joining us by phone, to visit our symposium site, ADBCAP symposium.com. Okay. So one of our panelists, as I mentioned, is joined by phone, and I'll start by introducing her. So representing NAHLN, which is the National Animal Health Laboratory Network, we have Dr. Christina Loiacono. She is the coordinator of the network. Christy has been involved with NAHLN coordination since 2011, and prior to that, she completed a residency in veterinary pathology and has expertise in diagnostics and foreign animal disease investigation training. Next to me, on my right, your left, representing the National Plant Diagnostic Network, is Dr. Rubella Goswami, who is a national program leader with USDA NIFA. Rubella provides leadership for research and extension efforts in the area of pest management across all crops. Her current responsibilities include serving as the co-director for the Crop Protection and Pest Management Program and as director of the National Plant Diagnostic Network. She is a plant pathologist with expertise in pest management, plant pathology, and host pathogen interactions. And to her left, her right, my far right, your left, representing Eden is Cheryl Skjolaas, current chair of the Extension Disaster Education Network. She's been active with Eden for many years. In her day job, she is an agricultural health and safety specialist with the University of Wisconsin-Madison. So same rules for this panel. Each panelist has been asked to provide a 5 to 7 minute overview of the network with which they're affiliated and highlight how the network, that network supports agricultural biosecurity. And if they don't answer all my questions, I'll ask a couple and then I'll open the floor to questions for these panelists. So again, please remember to wait until you have a microphone and tell us who you are before asking your question or making a comment. And John, I'm going to ask your help in resetting the timer. Thank you. So Christy, if you can hear us, this is your chance to go ahead.
Okay, thank you very much. Can you hear me okay?
Yes, we can.
Super. Okay, hi everyone. I really appreciate the opportunity to talk to you all about the National Animal Health Laboratory Network. I'm sorry I can't be there in person, but again, I appreciate the opportunity to call in. The network, the NAHLN, was established in 2002, and it was established based on the response to an outbreak that had occurred the year previous in the UK of foot and mouth disease. I think the reports were an $8 billion outbreak in the UK that the United States looked internally and said, how would we handle something similar? And determined that we really didn't have any kind of infrastructure or ability to take on something of that magnitude. So two agencies within USDA, the Animal and Plant Health Inspection Service and the National Institute for Food and Agriculture, partnered with the American Association for Veterinary Laboratory Diagnosticians and their laboratories and identified 12 labs that were already present in the United States with expertise and equipment and infrastructure already present, and decided to identify those, fund them, and ask them to be prepared to test for 8, I believe at that time, diseases of high consequence, diseases that we did not have in this country at that time. The purpose of the NAHLN, the purpose of our network, was the same in 2002 as it is today. That's not changed. And that's to provide early detection for high consequence diseases through targeted surveillance based on population density and risk. And currently we have 14 diseases or disease agents under the scope of NAHLN. And they represent foreign animal diseases or endemic diseases of high consequence. The second part of our purpose is to provide rapid response following confirmation of any of these diseases, and that's through a surge capacity testing outbreak samples. And then finally, for our purpose, we provide appropriate recovery from an outbreak where the laboratories would be expected to test large numbers of samples to show freedom of disease in support of providing that information to our trading partners and providing some consumer confidence in our animal population. So, although the purpose of the NAHLN hasn't changed since we initiated, the network itself has. We grew from 12 laboratories that were identified by USDA and AAVLD in 2002 to our current number of 59 labs. And if you have the handout that I provided, you'll see a map at the top, and that shows the distribution of the 59 laboratories, and they're present within 42 states. We also have the National Veterinary Services Laboratories represented by Blue Stars in Ames, Iowa, and then on Plum Island off of Long Island, New York. So these laboratories, the 59 laboratories, have to request approval annually, and during that approval, they identify the diseases within that list of 14 that they would like to be approved to test for. And they also agree to follow requirements that are put forth for the network laboratories. Because with 59 laboratories, in order to support a high integrity for our network, we have to have confidence in a test result coming out of our California NAHLN lab in the same manner that we would have that confidence coming out of for the same test coming out of the lab in Georgia. So in order to provide that confidence and maintain the integrity of the network, we had some founding principles identified from the very beginning. And those founding principles are listed at the bottom of the page that I provided. And it includes that each laboratory must have quality standards in place. They must have competent laboratory personnel, including trained and proficiency tested analysts. They must follow standardized protocols and equipment. So we, the reference laboratories from NVSL, provide the protocols for all of our diseases under scope. They must have a secure electronic communications and reporting system. And most appropriate for this, or most significant, for this group is that they must have appropriate biosafety and biosecurity facilities for the testing that they plan to do. And they also must maintain a high level of preparedness, and that's typically done through scenario testing, such as exercises and drills. So NAHLN, with the support of APHIS and NIFA, provides funding to our laboratories for infrastructure, and a lot of times that funding goes to support the biosecurity and biosafety efforts within the lab. So currently, I said we have 59 labs. We do provide 5 categories that the labs can fall into depending on their level of meeting requirements, the level of commitment. That also identifies the level of funding that they will receive. And we currently have 17 laboratories in our highest tier. That's our level 1 lab, plus 6 branch labs. We have 27 labs in our level 2 category, 7 labs in our level 3, and then we have 1 affiliate lab. So level 1, 2, and 3 represent our state and university laboratories. Our affiliate lab is another federal laboratory, the USGS lab in Wisconsin. And then we have a 5th category called specialty labs that was developed for any private laboratory that's still a niche testing for us. Currently, we don't have any specialty labs within the network. So the requirements of our levels, again, level 1, our top tier, has the highest level of requirements. They do the most testing and they carry the most responsibility within the network. And requirements include being fully accredited for their quality management system, and that can be through an AAVLD accreditation or being accredited to the ISO 17025 standard by a third-party accrediting body such as HOLA or Perry Johnson. They also must have BSL-3 laboratory facility that's operational and can support any testing that they would do in the face of an outbreak. And then thirdly, they must be able to electronically message test results. Level 2 labs must also be accredited to their quality management system, but can be accredited to a lower level. But they also must follow laboratory biosafety requirements and be working towards electronic messaging. And then our Level 3 labs, again, our lowest level of state and university funded representing laboratories, must have quality management standards in place and must, again, agree to follow laboratory biosafety. The activities of the NAHLN are primarily for surveillance. That's both active surveillance, and 9 of the 14 diseases have routine surveillance done around the country. And we're also very involved in passive surveillance or foreign animal disease investigations. We're involved in emergency response. And then to support the founding principles, we do support assay validation, development and validation. We manage proficiency tests for all of our diseases under scope. And we do support veterinary services initiatives, primarily when they're looking to do testing and they need high-quality labs where they can guarantee accuracy of results, and then the non-program office can manage whatever testing is needed through communication, reporting, and reimbursement if that's part of the activity. So primarily the biosafety, biocontainment needs of the network surround our effort to identify foreign animal diseases or diseases of high consequence, and it is a very important part of our network. I'm not sure if I heard the timer, but I'm pretty much done with what I was going to share.
Okay, thank you, Christy, for that great overview of the NAHLN. So we're going to turn next to Rubella.
Okay, since Christy has given a little bit of background, so I'll save you from talking about the history. We were started about the same time as NAHLN, and we had other plant diseases like soybean rust that led the leaders to decide that we really needed to pay attention to it, and ag biosecurity and plant diseases and animal diseases didn't really have the network, the infrastructure, the coordination, or the capability to handle a major outbreak. So, like the NAHLN, we all get funded actually through Homeland Security. It's something, a package, a line item called food and Agriculture Defense Initiative. So the NAHLN, the NPDN, and the EDN that we'll hear about are all funded through the FADI line. So talking of the NPDN, it is like the NAHLN, but slightly different in the sense that it is a network of plant diagnostic labs that are spread all over the country. So we have diagnostic lab in all the 50 states and also some of the territories. But in our case, we function a little differently in the sense that we do not limit ourselves to the regulated diseases, but we accept all sorts of diseases. So if you have a problem in your home garden, you can certainly take the samples to the closest diagnostic lab, and there will be one generally in the state that you are in. So we run this network funded through NIFA primarily. Again, the funding model is slightly different in this case. We partner with APHIS and we support APHIS in the case of outbreaks. So our labs serve as surge labs for APHIS, but we are not funded by APHIS. So the funding comes mainly from NIFA, which it allows the flexibility that we have. However, we do partner with APHIS. We have a very strong accreditation system as well, because we need to make sure that our data is reliable. Our diagnosticians, when it comes to regulated pests and when it comes to quarantined pests and things of that sort, are trained by APHIS. So we follow the APHIS protocols in those cases. Otherwise, we have our own set of protocols, well vetted and well tested across the world. So, as I was saying, we have labs in all the 50 states, and generally it's the land-grant university that has the plant diagnostic lab, but we also partner with state departments of ag, and in certain cases, industries as well. So, if there is an outbreak, we have had companies voluntarily jump in and contribute, even sometimes without getting any money for what they're doing. So that's a great way of leveraging the resources that are available. The NPDN maintains a huge national repository, so all the data, we have over 1 million diagnostic records that are available for all the diseases that have been detected across the country. So this is a great source for research and other, monitoring and prediction modeling. Those sorts of things are also available as part of NPDN. Now, to explain how it is set up, I said they're all 50 states, but they are divided into 5 regions. So we have regional, what we call hub labs, which are main central labs that have the capacity to do almost everything. They generally have the capacity to provide the search support and all specialized activities that are needed. There are 5 hub labs in the southern, the south, the north central, Great Plains, northeast, and the west. If you look at the handout that I gave you, it does have the leadership for each lab, the current leadership for each lab that's listed in there, in addition to all the things that I've been talking about. So in case you are interested in this, you can reach out to the lab. Our website is also listed in here. NPDN does have a newsletter that comes out. I feel for those who are interested in ag in general, those newsletters are nice to read, even if you may not be working with plants, but oftentimes they are general common diseases that you see around in places that are there. But the website has a lot of other information, the standard protocols, and everything that is there. So we have the website listed. The other information on the back side of your handout, there is the map of the different regions and the locations of our regional hub labs, and a diagram, if you can read it, I can provide an electronic copy if you want, is the process that that a typical sample follows when it comes into an NPDN lab. Because we do have a process in which, we do the detection and we communicate. So the 3 main things, like the NAHLN for us, is rapid detection, accurate diagnosis, and timely reporting. It is very important because in the case of animals, in the case of plants, we don't have vets in the state. So our diagnosticians are the eyes and ears of what's going on. And the diagnosticians, being in the land-grant universities, actually connect even APHIS in certain areas to the extension service, so people out in the field. So we do first detector training. We do other activities that lead to making sure that whatever comes out is captured in time for something to be done. So if you have a diagnostic sample that you send in, oftentimes most of the labs will be able to also give you a recommendation of management practices that goes with it. So it's a pretty good thing. If I have a minute?
You do.
I just wanted to mention, since I'm kind of the odd person here talking about plants, and I'm from NIFA, we in the plant, it's not necessarily the plant world, I would say it's the integrated pest management world. We do have programs that fund animals as well. So our crop protection pest management, though it says crop protection, there is a program called Extension Implementation that essentially funds the extension service across all the states. It is a competitive program. I'd call it a semi-competitive program the way it is set up, but one of our priorities is animal ag. So we have a significant portion of the states where they get some amount of money to work on animal diseases. And this is often done, these proposals are submitted normally 1 per state or 1 from an institution in a state. So there is an IPM coordinator in each state. And the IPM coordinator will be able to link you to the person who submits the proposals for EIP. Oftentimes it's the IPM coordinator himself or herself who is the PD of the grant. So if you're looking for very applied things, connect up. And then we have IPM centers also. There are 5 regional centers. The director for the Northeast region is here, Deb. So that's another way that you can connect up to the pest management aspect, but it covers animals as well to an extent.
Great, thank you for sharing that. Pass next to Cheryl.
Thank you, Julie. Thanks, everyone. It is an honor to be here tonight and at this conference to represent the Extension Disaster Education Network, as we know it as EDN. But I'm not the only one from EDN here in the room, and just so that everyone sees, even in this group, the scope of that network, those of you that are involved with EDN, would you raise your hand? So we have a fair number of EDN representatives, as part of this, which is great. A couple of people that I would specifically like to identify so that if you have some questions tomorrow or in the future and that you're aware of who those individuals are. Abby Hostetler, I'm going to get that name smoother than Skjolaas eventually, is our EDN National Project Coordinator. The FATI funds, as were mentioned, went out this past year on a competitive basis for the first time, and the Purdue Extension was a recipient of that cooperative agreement, and so Abby is our representative and our coordinator on those FATI funds and works nationally to help support our network. I'd also like to introduce Andrea Higdon. Andrea has been involved with EDN for many, many years too, but her area of interest has been our agro-security work, and she's been a strong supporter in that area, and I wanted to introduce her as she is currently serving as our chair of our now Agricultural and Natural Resources Standing Committee, which previously was our agro-security committee. So just a little bit about the Extension Disaster Education Network, assuming some of you in the room might not be as familiar with it as some of the rest of you are. Back in 1993, there was significant flooding on the Mississippi, the Missouri River. Some of you might, even this year with the current flooding, Nebraska, Missouri, down to Mississippi, have heard reference to those 1993 flooding. And the extension services of the states in the north central regions got together and said, how can we work, in the future so that we're all not recreating the information that we need, that we have that research-based information that we can bring out to those local communities, in response to these disasters, but also to help our communities as they recover and grow out of these natural disasters. And so a couple of years later, they came up with the name, the Extension Disaster Education Network, or EDN. Since then, we are now have representatives from all the land-grant institutions. So EDN is a member network, and it's the institutions that are the members. It's not individuals. And those individuals from those extension-serving institutions then become the delegates into the network. And it's a way that our extension service, working collectively with other federal agencies and state agencies, can help bring that research-based information and programming down to those local communities, which is the base of our extension service throughout this country. And so we're really happy that in 25 years, we are throughout those 1862 land-grant institutions. The 1890s, we currently have 14 or 15 of the 1890s that are part of the network out of the 19, and the Sea Grant extension programs are becoming very active participants. So the scope of our programs and the work, transcends across our programming areas and extensions. So ag and natural resources, family, 4-H and youth development, and community development. So that cross-programming, that interdisciplinary program is really probably one of our strengths as a network. And then also the fact that those, EDN can tie back into those other agencies that we can work with on all levels. And so as we work to get that creditable research-based information, we have through the years built a resource catalog, and you'll note that we have a website there. I would mention that website is going to be changing here with the change of the grant, but this URL will get you there, and we have some exciting things coming down the road. since we're limited here, if the second page of the handout, just to reference, is tying to some of the Agra security efforts within Eden and the network. And so as I mentioned, Eden now does have the FATI funds. We've been receiving FATI funds since 2011. And so using those funds to help strengthen the network and do some special focused areas. And we highlighted 4 of them here for you. So we've done agro-security workshops, or strengthening community agro-security preparedness, or SCAP workshops. Those were offered in 26 states. And so that's one of the ways of a program example that we've had. That partnership engagements, working, we've had a great work group, and I'm not sure if Reagan, Jeannie, if you've been part of developing those VTTX exercises. And so working with FEMA, EMI to get out to those emergency coordinators, training on agriculture, and doing those exercises. We also have 2 courses. Of course, one relating to animal agri-security and another one related to plant biosecurity. And since our network is really made up of those extension professionals, and that extension professionals are really our first audience, those courses were originally designed to help support those professional development of those extension professionals and then other professionals in the field. So we still have a strong purpose in helping our extension professionals gain professional development in this area, have the resources that they need. And so connecting into the area of biosecurity here is a great opportunity. I've heard some things mentioned today about research, and there was a couple of them that it's like, oh, that'd be some great research to see how do we bring it down to our extension and help extend that education. Couple just last fast comments here, Julie. If you look at upcoming engagements with the new FATI fund, we're going to be having some listening sessions, and one of those will help direct our future activities in the area of agri-security and the ag and natural resources. So if that comes across your radar screen, look for that. There will also be some grant funding going out to our extension projects, and that those might be ways that you could be collaborators on and tie into those funding opportunities. So thank you.